Hey everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. Today, we're discussing another important over-the-counter drug for allergy relief. If you or someone you cared about experiences seasonal or year-round allergies and have found some nasal sprays irritating or uncomfortable, this scent-free, once-daily option may be worth considering. That medication is Rhinocort. Rhinocort contains budesonide, a well-studied corticosteroid with decades of clinical use, not only as a nasal spray in allergy medicine, but also in health formulations for respiratory conditions. This long history contributes to a well-established safety profile. In addition, Rhinocort is formulated without certain preservative used in other nasal sprays, which may make it more tolerable for sensitive individuals. In this episode, I'll walk you through 5 key things to know about Rhinocort: its indication, how it works, how to use it properly, important warnings and precautions, and its safety profile. And if you're new here, don't forget to like, subscribe for more science-based medical updates. Now, let's dive in. First, what exactly is Rhinocort and who it's for? Rhinocort is an intranasal corticosteroid spray containing budesonide. The over-the-counter version is approved to temporarily relieve symptoms of hay fever or other upper respiratory allergies, including nasal congestion, runny nose, sneezing, and itchy nose in adults and children ages 6 and older. The prescription formulation was first approved by the FDA in October 1999 and transitioned to over-the-counter status in March 2015 with the same active ingredient and strength. Rhinocort can be used for both seasonal pollen allergies and year-round allergies triggered by dust mites or pet dander. For patients who do not achieve adequate control with oral antihistamines, Rhinocort may be a good next step. Second, how does Rhinocort work? The active ingredient in Rhinocort, budesonide, is a corticosteroid with broad anti-inflammatory activity. It suppresses multiple immune cells and inflammatory mediators, helping to reduce swelling and mucus production. By acting directly on the nasal mucosa, budesonide treats the underlying inflammation that drives allergic rhinitis. Some people may notice improvement within the first 24 hours, but the most benefits may take up to 2 weeks of regular daily use. Staying consistent is important for optimal control. Third, let's talk about how to use Rhinocort. Rhinocort is for use in the nose only and should not be sprayed into the eyes or mouth. Each spray delivers 32 micrograms of budesonide. For adults and children 12 years and older, the recommended starting dose is 2 sprays in each nostril once daily while sniffing gently. Once allergy symptoms improve, the dose can be reduced to 1 spray per nostril daily. For children ages 6 to 11, the recommended dose is 1 spray in each nostril once daily while sniffing gently with adult supervision. If allergy symptoms do not improve, the dose may be increased to 2 sprays in each nostril per day, then reduced back to 1 spray in each nostril per day after symptoms are improved. If you miss a dose, take it as soon as you remember. If it is close to your next scheduled dose, skip the missed dose and take the next dose at the usual time. Do not take a double dose to make up for a missed one. Before first use, gently shake the bottle and prime it by pumping 8 times. If unused for 2 consecutive days, reprime with 1 spray or until a fine mist appears. If unused for more than 14 days, clean the spray tip as directed, then reprime with 2 sprays or until a fine mist appears. Detailed step-by-step instructions are provided in the package insert. But here are several key points. Before each dose, gently blow the nose to clear the nostrils and always shake the bottle, since Rhinocort is a suspension and needs to be well mixed. Place the nozzle tip into one nostril, close the other nostril with the finger, and lean your head slightly forward so the spray will aim toward the back of your nose. As sniffing gently, press down on the spray nozzle and then lean your head backward for a few seconds. Refrain from blowing the nose for 15 minutes after using Rhinocort. Avoid spraying directly on the nasal septum, the central wall between the two nostrils, which contains many blood vessels and limited nasal tissue. Spraying directly on the septum may increase the risk of nosebleeds without improving symptoms. Use caution when taking Rhinocort with strong CYP3A4 inhibitors, such as certain antifungal medications or HIV treatments, since they can increase systemic exposure to budesonide. It is always good practice to review all medications and supplements with the doctor or pharmacist to look for potential interactions. Fourth, let's review the warnings and precautions. Hypersensitivity reactions have been reported with Rhinocort and may cause anaphylaxis, hives, rash, and swelling of the face, mouth, or tongue. If this occurs, stop Rhinocort and seek medical attention right away. Local nasal adverse events may develop, including irritation, nosebleeds, nasal ulcers, and in rare cases, nasal septal perforation, a hole in the cartilage between the nostrils. These risks are known with intranasal corticosteroids. For patients using Rhinocort for several months or longer, periodic examination of the nasal lining is recommended. Because corticosteroids can delay wound healing, patients with recent nasal ulcer, nasal surgery, or nasal trauma should avoid using Rhinocort until healing has occurred. Localized fungal infections, such as Candida in the nose and throat, have been reported with intranasal budesonide. Patients should contact a healthcare provider if they notice redness or white patches in the nose or throat. If such an infection happens, treatment may include antifungal therapy and stopping Rhinocort. Because Rhinocort contains a corticosteroid, it may affect immune system and increase susceptibility to infections. While on Rhinocort, patients should avoid exposure to contagious illnesses such as tuberculosis, chickenpox, or measles. If you have or had any of these infections or have relevant travel or exposure history, stop Rhinocort and consult with your doctor. Using Rhinocort at higher than recommended doses or together with other steroid medications for asthma, allergies, or skin conditions may increase the risk of systemic corticosteroid effects, such as hypercorticism and adrenal suppression. Ask a doctor or pharmacist before using Rhinocort if you're taking other steroid medications. Corticosteroids may also contribute to the development or worsening of glaucoma and cataracts. Patients with a history of elevated eye pressure, glaucoma, cataracts, change in vision, or eye infection should speak with a doctor before using Rhinocort and consider close monitoring during treatment. A new or worsening vision changes should be evaluated promptly. In children, corticosteroid use may slow growth. Pediatric patients should use Rhinocort for the shortest duration necessary to achieve symptom relief. If a child needs to use Rhinocort for more than 2 months per year, this should be discussed with a healthcare provider, and growth should be monitored for prolonged use. And finally, let's talk about the side effects and safety. In clinical trials of the prescription formulation for allergic rhinitis, in patients 6 years and older, the most commonly reported side effects were nasal irritation, nosebleeds, sore throat, cough, and breathing difficulties such as wheezing or chest tightening, with many occurring at rates comparable to placebo. Nosebleeds were observed more common in patients using Rhinocort than in those receiving placebo. If you experience frequent or severe nosebleeds, stop using Rhinocort and consult a doctor. If symptoms do not improve within 14 days of starting treatment, or if new symptoms such as persistent fever or thick nasal discharge develop, this may suggest something other than allergies, such as an infection. In that case, stop Rhinocort and get medical evaluation. Overall, when used as directed, Rhinocort has a well-established safety profile. And there you have it, 5 key things to know about Rhinocort, a once daily nasal spray containing budesonide, a corticosteroid that has been extensively studied across allergy and respiratory medicine and supported by long-standing safety data. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experiences in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.